Hello, my name is Karen. I'm a nurse specialist for the Lung Defence Service at Papworth Hospital. These video guides have been designed to help patients self-administer intravenous antibiotics at home. Being able to self-administer IV antibiotics in the comfort of your own home offers you freedom and flexibility. The nursing team will train you in all aspects of administering your treatment at home, or in some cases they can train a relative or carer. These videos are to complement the training you've already received from your nursing team. In some cases the processes may vary. If you're unclear of any of the processes and need more information, please contact your nursing team. They are there to offer you support, guidance and advice whenever you need it.
This is Ryan, who, step by step, will show you how to confidently and safely prepare and give your IV antibiotic. When preparing and giving your IV antibiotics, it is crucial to reduce the risk of infection. Use a plastic tray to prepare your IVs on. Give your work surface a good clean using disinfectant wipes or a disinfectant spray with a clean paper towel. Make sure you clean it thoroughly. Now wash your hands using soap and water. Follow the 6 stages of hand washing we showed you. When finished, turn off the tap. Do not use your hands so they stay clean, and then dry them thoroughly with a paper towel. First, arrange the medication on your tray. Have your equipment ready in the order you'll need it, making sure your sharp spin is within reach. Now check your medication. Read the labels. Is it the right medication? Is it within its expiry date? Has the packaging been damaged? If everything is okay, you can begin. First, you need to prepare your sodium chloride flush. Take the syringe from its packet, keeping hold of it in your hand. Open the packaging containing the needle, but don't fully remove it. With the needle still inside, connect it to the syringe. Throw away the unwanted packaging and place the syringe on the tray. Next, partially open the packet containing the cap. With the cap still inside, place that back on the tray. Next, twist off the top of your flush and put the flush ampoule back on the tray. Throw the top away. Now you need to draw up the flush. Remove the cover from the needle and throw it away. Next, insert the needle into the ampoule. Now, turning the ampoule upside down, draw out the flush in the way you've been trained by your nursing team. When finished, place the ampoule back on the tray and now check for any air in the syringe. If you see some, it's important to expel this. Push the air out until you see a tiny bead of fluid at the end of the needle, just like this. Now, carefully remove the needle and place it in your sharp spin. Now, pick up the cap you opened ready beforehand, place it onto the end of the syringe, then put it on the tray. Next, remove the infusion bag from its packaging. Using an alcohol wipe, clean the additive port for 20 seconds. Then, place the infusion bag back down in its packaging. The next stage is mixing the antibiotic. First, remove the syringe from its packet, throwing the packaging away. Keeping hold of the syringe in one hand, with the other pick up the needle. Again, connect it to the syringe while still in its opened packaging. Throw the rubbish away and place the syringe on the tray. Next, pick up the vial containing the antibiotic. Remove its protective cap and throw it away, and place the vial back down on the tray. Next, open your alcohol wipe and use it to clean the top of the vial for 20 seconds. Put the vial down, throw away the wipe. Now twist off the top of the ampoule containing the dilutant and throw that away. Place the ampoule on the tray. Remove the cover from the needle and throw it away. Keeping hold of your syringe, with your other hand pick up the dilutant ampoule. Insert the needle, turning it upside down. Draw the dilutant out in the way you've been shown by your nursing team. When finished, throw the ampoule away. With your antibiotic vial sitting on the table, pierce its top with the needle. Next, pick up the syringe and vial together. Slowly push in the plunger, injecting the dilutant. Holding the syringe and bottle horizontally like this, gently mix the powder until fully dissolved and the fluid becomes clear. Next, turn the vial upside down. Keeping the needle in the liquid, draw all the liquid out. Then place the vial down. Now, you need to expel any air from the syringe. Push in the plunger. When the air is expelled, you should see a bead of liquid at the end of the syringe. Now, you're ready to add this to the infusion bag. Place the infusion bag on the tray and very carefully insert the needle into the additive port you've previously cleaned. Be careful not to pierce the bag, and inject the antibiotic. When finished, place it in the sharps bin. Now turn and invert the bag like this about 5 times to make sure its contents are mixed. Now prepare your heparin flush. Remove the syringe from its packaging. Keeping hold of the syringe, pick up the packet containing your needle. Partially open it. Place the syringe on the tray. Partially open the packet containing the cap and place that back on the tray. Next, pick up the heparin flush. Carefully snap off the top and put in your sharps bin. Put the ampoule back on the tray. Remove the cover from the needle and place it in your rubbish bag. Insert the needle into the heparin flush and carefully draw out the liquid in the way you've been shown. When finished, place the ampoule back on the tray. Unscrew the needle and throw it in the sharps bin. Now, check for any air in the syringe. When it's all gone, you should see a small bead of liquid at the end, like this. Now pick up the cap and place it on the end. Now prepare your giving set. Remove it from its packet. Remove the tape and unwind the tube. Now, moving the roller down, close it completely like this and place the giving set back on the tray. Now, pick up your infusion bag. Take the cover off the other inlet and throw it away. Pick up the giving set and remove its plastic cover. And insert the giving set spike into the infusion bag, carefully twisting it into position. Now the giving set needs to be primed. Hold up the infusion bag and squeeze the chamber of the giving set. You need the liquid to reach halfway inside so it reaches the marker line on the chamber. Now, using the roller, open the line so fluid can pass through it, right to the end of the tube. Once primed, close the roller. Place it down on the tray. That is your preparation complete. Now, wash your hands. Now, find somewhere to hang your infusion bag. A clothes hanger on a door frame works well. Now get comfortable. Next, roll off your bandage and unfold the gauze, freeing up the bionectar inside. But before you proceed, you need to check around the venous access line, looking for signs of infection, redness or swelling. Is the area tender? If so, tell us as soon as possible and do not under any circumstances give your medication. However, if everything's okay, carry on. First, you must clean the bionectar using an alcohol wipe. Clean the end thoroughly for 20 seconds. Then let it dry for 30 seconds. Now you need to flush the line. Pick up the first syringe of flush. Remove its cap and attach it to the bionectar. Open the clip and push in the plunger, giving the amount of flush you've been shown. When finished, remove the syringe. Replace the cap and place it back on the tray. Now, keeping hold of the bionectar, you need to connect the infusion bag. Remove the cap of the end of the line and throw it away. Carefully connect it to the bionectar. A pushing, twisting motion like this will do it. To give the infusion, open the giving set roller. Set the drip rate as you've been shown by your nursing team. Now sit back and relax until the infusion is finished. When it's finished and the bag is empty, close the giving set roller and take down the hanger and infusion bag. Disconnect from your bionectar and dispose in your sharps bin. Now, you'll have to flush the line twice. Picking up your remaining sodium chloride flush, remove the cap and once again attach it to the bionectar. Give all the flush until it's gone. Disconnect the syringe and throw it in your sharps bin. Now for the heparin flush. Remove the cap and attach the syringe. Taking hold of the clip, Push in the plunger until almost all the solution is gone. Now, as the plunger reaches the end, slowly begin to close the clip whilst continuing to give the flush. Only close the clip completely when all the heparin flush is gone. When empty, throw that syringe in your sharps bin as well. Now, using an alcohol wipe, you need to again clean the bionectar for 20 seconds. Now wrap the line back up in the gauze as you've been taught and roll up the bandage. Tidy away. You've given your antibiotic. Well done. But don't forget, afterwards, always wash your hands.